Dear students, welcome back. In the previous session, we have discussed about shock. Now, in this session, we are going to discuss about the burns which are caused due to electricity. So, burns are injuries to tissues caused by heat, friction, electricity, radiation, or chemicals. Two types of burns can occur with the application of electrotherapy currents. They are chemical burns and electrical burns. Okay, so here you can see the chemical burn. So this is some type of severity of the chemical burn which can be seen normally with the electrical currents, but not in the electrotherapy department. We can't see this much of burn, okay, if you take proper care. So the chemical burn is produced by the application of direct current. Destruction of tissue take place. The burn appears as gray spots surrounded by a reddened area. There is a coagulation of tissue at anode, okay, and liquefaction at cathode, acid formation under anode and alkaline formation at under anode. Okay, so a long duration pulses produce more burn. A longer duration pulses causes more burn than the short duration pulses. A uniphasic pulse produces more burn compared to biphasic pulse. Okay, so the order of producing the severity of burns is as follows. The sinusoidal currents produce less than Faradic, and Faradic burns are less than galvanic, and galvanic is less than that of current used for iontophoresis. That is the order of producing the severity of burns, of chemical burns. Okay, how can you treat this chemical burn? Healing takes place by secondary intention. Area should be kept dry. It should not be become infected, so it is protected by dry sterile gauze. The healing is accelerated by infrared therapy. Okay, how can you prevent the chemical burn? Use of a reversing switch after the treatment in order to change the direction of current. Change the polarity of the electrode after the treatment. Increase the intensity gradually. Check the sensation. Lint pad should be 16 layered. Reduce current density by using large electrodes. Okay, avoid direct contact of metal electrode with skin. Use the coupling media so that electrochemical changes takes place outside the tissue. Okay, now if you see the electrical burns, so such kind of blisters we can see in our department, but these two are the severe electrical burns. So this can be seen for higher intensity of the currents, these two types. Okay, electrical burn happens due to shock when your body becomes contact with metal electrode directly from the junction of lead with rubber electrode when it is loose. If point of contact of pen electrode is too much pressed, if you give some stimulation through the open wounds and through scar marks, how can you prevent for this electrical burn? And this is same as that of the previous electric shock management. That means disconnect the victim from the source of supply if the person is getting a severe shock. Okay, so equipment should be switched off. Contact with the patient with a layer of insulating material. Reassurance the victim. A rest should be given. Give water to prevent dehydration. Avoid hot drinks and refer to a physician. Okay, these things should be done if the victim or a patient is conscious. If unconscious patient, if there is no sign of cardiac and respiratory arrest, then put the patient in rescue position and loosen all the tight clothing for respiration. If patient is unconscious and there is a sign of cardiac and respiratory arrest, then perform CPR, that is cardiopulmonary resuscitation, which includes the basic steps of airway, breathing, circulation and defibrillation, and finally oxygen therapy, and refer to physician. These are the things have to done for the patient who are having the electrical burns. If it is severe, then you can. Okay, so this is all about the types of burns which are caused due to electricity in the electrotherapy department, and these are all the severity of the electrical burns. We can see small blisters, not this much. We can see the small blisters like this, or very minimal. If the equipments are properly connected and wirings are properly done, we can prevent all these such kinds of burns. Okay, so in the next session we are going to discuss about the electrical stimulation of nerve and muscle. Thank you.